health insurance personalized. This is Consumer's Doctor on the behalf of foremost organization. We always strive to see how we can deliver the healthcare for the poor and who can't afford the healthcare and who needs help, especially for people with disabilities, people with economically impaired group. It's there is a element, there's an instrument, Medicaid. Nationally is known as Medicaid. In California, we call it Medi-Cal. Let's look into it. Let's look into Medicaid challenges. Again, since it has been set up, it has not been transformed. It has, this is what it is. Once you have a legislation passed in Washington and the states follow through on the state mandated Medicaid, so-called Medicaid, it needs to be changed, folks. Let's look into it, how we can improve these services to the poor and with people with disabilities, people who are economically impaired, people who cannot afford to have health insurance. Let's see how we can modify it towards the benefit of all Americans, folks. That's my goal. That's what I want to see. If anyone is listening, let's explore that. America's Medicaid challenges reach well beyond finances and budgets. A money-only policy debate will quickly become counterproductive, result in a power struggle between the federal government to charge, federal government's charge to spend less. That's the federal governments want to do, whereas states governments maneuvering to leverage more out of the federal government. So it is always a tussle between federal and state. Medicaid is a state's responsibility. Medicaid is a state's responsibility and state's budget. But federal government has to assist in providing the health for the poor and disabled. To achieve a real transformation, folks, to achieve a real transformation in Medicaid or Medi-Cal, government leaders must wrestle with fundamental problem. Fundamental problem. One program design cannot meet the needs of such distinct and separate groups of beneficiaries. The frail elderly, the poor, and the people with disabilities. Yes, people with disabilities. They are radically different groups with radically different needs, and they need radically different program designs, folks. That's what it is. It requires a radically different program designed to different groups of individuals. Medicaid should be divided into 3 distinct sub-programs, folks. They need to be divided into 3 different sub-programs, each administered separately with its own rules and structures. All sub-programs should be based on the following principles, folks. Following principles. Let's look into that. A 21st century Medicaid system will focus on wellness, prevention, early detection, and independent living, folks. Independent living. Independent living. A 21st century Medicaid system will integrate the family and community into the healthcare and the lives of the loved ones. Lives of the loved ones. And a 21st century Medicaid system will leverage the innovations in science and technology and quality systems and with best practices in every aspect of providing the care for its beneficiaries. Yes, for its beneficiaries. Let's look into it a little more detail. First program I was talking about is called Capabilities Program. Capabilities Program designed with a mission to serve people with disabilities by allowing them to lead the fullest possible lives. We all would like to see that, allowing them to the fullest possible lives. The Capabilities Program would capitalize on technologies and therapies that maximize the beneficiaries' abilities, not their disabilities. That's important, folks. Program would capitalize on technologies and therapies that maximize beneficiaries' abilities, not disabilities, and put a high value on the integration into social, family, work life without losing all their benefits. Yes, without losing any one of those benefits. In addition, capabilities, life savings accounts, and other tax incentive saving vehicles should be created. Even they deserve tax savings accounts, folks. They deserve tax saving accounts. And tax incentive saving vehicles should be created so parents of the children with severe disabilities would be encouraged to put money aside for the care of their children when they reach adulthood. So they should have tax incentive, they should have savings accounts. Yes, they should have savings accounts. Second new program, folks, second new program would address the needs of relatively healthy poor, so-called healthy poor, who have much different needs than people with the disabilities. I think we all know that. They have different needs than the people with the disabilities or elderly who are frail. Elderly who are frail. Poor individuals should be offered vouchers. Should be offered vouchers for health savings accounts that sensitizes them to benefit of prevention, wellness, and early detection. By giving vouchers to these folks and having them have this savings account will incentivize and put money aside for prevention, wellness, and early detection, folks. That is the second one. What is the third part of the 21st century Medicaid Act? Would create a program to serve the poor, frail elderly. Poor, frail elderly. This program should integrate modern information technology systems, home diagnostic equipment, real-time monitoring, real-time monitoring, and rapid health assistance to support the elderly living independently for as long as possible. They should be living independently as long as possible. That's the main focus. They should be living independently as long as possible because they are frail. If they can be taken care of independently, that'll be better. For programs should reintegrate the family into the elderly care by allowing them to subsidize Medicaid's contribution to the facility who would help not only to the facility who would help not only financially but would also improve the quality and quality of life and quality of care for the patient if combined with a transition to best uses of information systems, electronics, and most modern therapies, folks. Most modern therapies. It could lead to a revolution in a quality of care for the frail elderly into the next decade. A Medicaid system divided into these three sub-programs would dramatically improve health outcomes and quality of life for both individuals and their families, folks, individuals and their families, while simultaneously producing substantial savings for the federal and state governments. It also is savings for the federal and state governments. This is the beauty, folks. This is what I've been talking about. We need to have this Medicaid system needs to be revamped, focus being towards the consumer, towards the individual, towards the family, towards integrating technology and other resources to the benefit of both the government and for the individual, or especially people when they are economically impaired. We should be able to provide voucher system for these folks, and they should be able to put money aside for their own future health prevention, health being proactive. It always helps these folks, and they should have a voucher system where they can put money into their own savings. That will go a long way to these folks. Well, I have I would like my passion is towards the people, these folks. My as a consumer's doctor, my passion is that will lower the uninsured, that will lower the numbers for the uninsured. We have the resources, we have the technology, we have all these things. Why we can't put everything together and do the best we can for these so-called revolutionary Medicaid into practice? Thank you for listening. Thank you for joining personalized, so-called HIP, Health Insurance Personalized, and thank you for joining Consumers Doctors channel. And we will see you in the next episode. Goodbye and salute.